All right, good morning, everybody. This is Cassie Johnson here with the Lake Mills Chamber, and we are having a chamber coffee this morning with Brian Budach from the Lake Mills Physical Therapy.
Good morning.
Good morning. Before we came here, I looked at a couple of your Facebook posts and saw some of your fun videos.
Yes, I'm not going to take up acting anytime soon.
If you want to see those, go over to their Facebook. They're pretty fun, kind of goofy, lighthearted.
Yes.
Check them out. So tell us now a little bit about what Lake Mills Physical Therapy specializes in.
Yeah, so I actually would say that we don't specialize.
Okay.
Being a rural outpatient clinic, we really have to have the ability to treat whatever walks through our door. Mm-hmm. So if we did specialize, we really would be giving a huge disservice to the Lake Mills and surrounding area.
Yeah.
As with most outpatients, we generally see orthopedic conditions mostly, which is bone, joint, muscle issues. But we'll see neurological, we'll see pediatric conditions. So it's kind of, spans the whole spectrum of physical therapy. What's nice is we brought in Michelle. Michelle runs a Big and Loud program for us, which is directed towards Parkinson's patients.
Oh, okay.
So she's certified in that. And then she's also pursuing further education in women's health to offer that service.
Okay.
I have felt this since I came here, that I really think women's health is greatly underserved, particularly postpartum.
Okay.
So Michelle's going to really be able to expand that service that we can provide and help, women. I mean, pregnancy is hard on the body, and and she can help them keep back to what they want.
Yeah, well, that's awesome.
So otherwise. Emily and I will see anything. I really enjoy sports. Sports are my, the athletes are my, happy place. I really enjoy rehabbing them.
Okay.
But I enjoy, what's nice about our clinic is that because we do see everything, it's never boring. Everything is, there's always something new coming through the door, and even that said, we can have two patients with the same condition and they are completely opposite of one another. So, we never get bored with what we do. It's always fresh and new to us
kind of like
and exciting.
Problem solving on a daily basis.
It is, and it makes you think and keeps you on your toes.
Yep.
And but it's awesome.
Yeah. Speaking of conditions, what kind of injuries do you see this time of year, and maybe what are some tips you can give people to avoid those?
Well, that's kind of twofold. So if we divide you up into athletes and then the general public, so the general public, usually it's injuries from slip and falls. If you break something, we'll see you 6 weeks later.
Okay.
So that's some of it. Athletes right now are kind of entering this transition zone from winter sports into starting spring sports.
Yep.
Especially, athletes nowadays are doing multiple sports at the same time. So we get a lot of overuse injuries this time of year and then into spring. So that's generally what we see, and for them, I really advocate rest periods. Your body needs about a week between seasons, and then I really wish athletes would just do one sport, at a time.
Yeah.
Because again, it's so much time competing and on a practice floor or the gym floor, then your body just wears down.
Right.
But athletes are highly motivated. I think I would almost say they're more motivated than back in my day.
Yeah.
I can say that now because that was 20 years ago. So, and some of that's good. I think it helps them from a performance standpoint, but also kind of leads to more injuries.
Yeah.
And then, for the general public, again, most of the stuff we see for them is either post-surgical, like they're having total knees or total hips or something like that. Rotator cuff tears we see, but otherwise from a slip and fall, it's just watching your footing, trying to avoid the slippery spots when you can.
Yep.
But
wearing good shoes.
Life happens.
Yep.
And the good news is bones heal pretty well. So.
Yeah.
Yeah.
How easy is it for someone to come in and see you when they have something wrong?
It's very easy.
Okay.
I would say the vast majority of the time you can just walk through the door and set up an appointment. You don't. A common misconception is people think they need a physician referral to come see us, and for the vast majority of the time you don't.
Right.
This is all insurance decided, so if you're Medicare or Medicaid, you do require a referral for those insurances. But for most commercial insurances like Blue Cross or Aetna, United Healthcare, we don't need a referral. You can just come right in, which helps from an access standpoint, so we can get you in as soon as we can.
Yep.
And it's numerous studies have shown, especially pertaining to low back pain, that the sooner they get into therapy, there's almost a 30% reduction in cost of care for that low back pain.
Okay.
So that's a huge, advocate of us is we're trying to get you in. And some of that is, family practice is inundated with pharmacology and other type of conditions, and they're busy. So, we can get you in and start rehabbing you immediately.
Right.
Basically, so.
Yep.
Yeah.
Well, that's all good. You were speaking about athletes earlier, and I just wanted to make a comment that you were able to attend state wrestling last week.
Yes.
And then maybe we just want to talk a little bit about
me.
how you work with the school.
Yeah, so Alex asked me to join him this year. The wrestling team was a little beat up, particularly from midway through towards the end, so he just felt more comfortable with me coming down. And I love wrestling. I was a wrestler, so it was exciting being down there and being with the team. And hopefully I can make that happen again. But, I do have the contract with the school I go to the school every Monday after school to screen the athletes and help, and I really encourage athletes to use that because, I try my best to help them without them having to go see whether it's me, a physician, or something else. I really want to manage them, at the school. Let's give you some things to do and see if we can get through this without you having to go anywhere. For some that works, for some it doesn't. Everybody heals different. So I provide that service, and then I do event coverage for them for the contact sports, which is going to be football, wrestling, and track. Actually, we cover a lot. So, we just want to provide that coverage to, especially during the home events we're there. It really helps the coaches. They don't have to make medical decisions. I'm unbiased on that standpoint of if a kid should play, shouldn't play. Particularly when it comes to concussions, it's a gray area and it's a hot topic. And, I really just take that off of the coach's hands so that we can objectively, make good decisions. Providing that service, I think, to the athletes really helps them just try to stay on the court. I can give them all the advice they need. At some point, they're gonna have to listen to it, type of thing. But I really just want to be there. And provide them easy access to questions if they have questions about what they can do, if they have just a sprain, strain, or tweak here and there. And then, we come up with plans as far as, I think that needs to go get looked at, or, and even parents, if parents have questions regarding that, they can call me and we do free screens up at the clinic to kind of help create a plan, like who should they go to? I really appreciate all the medical providers in the area, but urgent care and ER sometimes isn't the best place to go to get the medical care that you actually need. So sometimes I like to guide you to at least where they should go to get the best advice that they can. From a therapy standpoint. If you have questions or you're like, I've had this ache and pain for years, or I've been getting it treated for years, that's things shouldn't linger for years. There's a lot of things that can be approached differently with therapy, whether it's from an exercise standpoint or a manual therapy standpoint. And I think we can help you, work through things. And the ultimate goal of therapy is we want to give you the tools you need to keep yourself out of therapy.
Right.
It's a terrible business model, but that's what we want to do.
They don't want to see you come back.
Yes. So come in and smile and say good to see you, but that's about it. We really want to help you, stay healthy and performing that home program. And we really just want to give you the bare minimum that you need, help you get back to your function, and then keep it that way. So as we age, our body changes, but you can have a ton of arthritis all over and not have any issues.
Right.
And you can have mild arthritis and have quite a bit.
Pain.
So, keeping limber and keeping active is by far the best thing that we advocate in medicine total to general health.
Awesome.
Actually. So, and I think, bringing Michelle on board and kind of expanding those offerings that I discussed earlier, women's health and Parkinson's, I think just helps broaden our horizon to what we can help in this area.
Right.
Because ultimately, we want to see our patients succeed. Our reward is seeing them getting back to what they want to do. And just to be honest, we can't fix everybody who comes through the door. But I think where we excel is if we can't, help you, or if you're not improving with therapy, we want to make sure that we're directing you to where you need to go,
Yep.
so that you can get,
Yeah.
the help that you need.
Right.
Instead of just being in this gray area of, waiting to go back to this doc, we do want to help guide you to where you want to go,
Yep.
Most effectively.
Mm-hmm.
That said, from a teamwork standpoint, Michelle likes to see different types of people than I like to see, and then comparing Emily and I'm usually a little bit more aggressive than she is, and
Okay.
she's a little softer. So some patients,
What they need.
yeah, and they kind of respond to that.
Yep.
So we're a great team and we work well together. Emily is really good at what she does. I bounce ideas off of her and
Yeah.
vice versa. And bringing in Michelle's really good. So it just brings having 3 good minds in there. 3 minds are better than 1.
That's true.
So that's what we strive for. Is we're always communicating, and we just want the patients to have the best experience they can get
Yeah.
when they come to therapy. They're already in pain. So we don't want to add to that. We're
No.
pretty lighthearted too in there.
Yeah.
We like to joke around, and most patients like that.
Yeah, I would definitely agree with that. If you guys have something you need help with, stop in. It's a welcoming group. You step in there and they immediately will say, "Hey, how's it going? How can we help you?" Great facility. Definitely utilize that. It's something that we pride in Lake Mills, so it's good. It's always good to have in the community.
Sometimes we get asked if we do specific type of treatments. From our treatment standpoint, is we follow evidence.
Yep.
We're going to provide care that science tells us works. That said, I'll do spinal manipulations, cervical,
Okay.
thoracic, lumbar. I do other, peripheral joint manips as well. We do some manual therapy where we use a tool, which is tool-assisted soft tissue therapy, along with ultrasound and E-stem, which are pretty, that's pretty common.
Yeah.
But there's a lot of gimmicks out there in certain medical fields, and I would caution, some of them works. Most of them aren't ever going to hurt you, but we just provide. We'll do what science says we should do.
Yeah.
And some of these newer ones just haven't been proven yet, and some of them are, they might end up proving to be very effective.
Right.
It just takes time for evidence to come
Yes.
out. So, if you have questions about any of those certain treatments, feel free to ask us about them, and we're happy to answer. If we do them, if we don't,
Yeah.
why or why not,
Yeah.
and if there's any adverse effects or anything.
Yep.
From that standpoint. So we offer a variety of treatment, not just exercise.
Yeah.
Exercise is a big component of it, but we do manual therapy and
Okay.
many other things as well. So
Very good.
yeah.
All right. Well, I have to ask, what is your morning drink of choice?
Oh,
favorite drink to order?
It is black coffee.
Black coffee?
Yes, no exceptions on that one.
I'm drinking a chai tea because we never really got into the coffee in
Really?
college or anything. So,
Well, I didn't until I had kids.
see, maybe I'm
Yes.
catching up there.
Yes, and now I walk in and Kelly just pours it. So.
Yeah, she just handed you that
Yes,
mug.
she did. Yes, maybe that means I come here too much. But
Maybe not.
I enjoy it.
Yep.
And I coffee.
Awesome.
That's-
Thank you, Brian, for being here.
Thank you, Cassie, for all you do.
Yes. Thank you,
Appreciate
and
it.
thank you to Swallow Coffee House for hosting us. We've got our coffee. We'll sit here and enjoy. And then the rest of you have a great Friday and a great weekend.
Yes, thank you.
All right.
Take care.